survived the surgery, which rhymes with perjury from the last video. I'm going to try to do this just in one go because I'll explain why, but my vision's kind of fucked. Hopefully it'll get better. But yeah, so they did the poem and I'm here. uh, when I got there, it was a little uncertain if they were going to do it because I should be looking there, whatever. Uh, it wasn't clear that they were going to do it because there were apparently directions I was supposed to get that I didn't. That I needed to be on a high dose of omeprazole twice a day after the last one. That was not communicated to me at any point. And um, our working hypothesis for why I had the stricture after the Botox shot. So stricture was noticed in May. Botox shot was beginning of the year, end of last year. Our working theory was that the Botox shot opened up my esophagus and it was brilliant, but was letting acid back up in, as can happen. And then that acid damaged the esophagus wall and the stricture formed. That was our theory. And it was a theory that was just completely dismissed. Like, that's crazy. Why would that happen? Until I'm sitting there just in the hospital gown waiting to be wheeled in, and the surgeon pops by. And I guess he must have reviewed the previous stuff and, like, oh yeah, no, there wasn't a stricture before. Yeah, maybe it was the Botox shot opening it up and it coming up, and because acid can cause that. And it's like completely just disregarding that this is what we've been saying. And he was like, no, that's not possible. They can't grow that fast. Whatever. Whatever. That's fine. Um, yeah, so I was wheeled into the surgery thing and just like, please, please, can we just do the poem? I don't find anything weird. I just want this done. I want this done and to move on with my life. Um, so when I came out of the anesthesia in the little recovery area, I was just like, it's like whatever Ebenezer Scrooge at the end of that story where he's like opening the window and like, anybody, what day is it? Just nurse. Did they do it? Did they do the poem? Husband, did they do it? Can somebody please tell me if they did the poem or not? So eventually, I did get my answer that yes, they did the poem. They didn't find anything weird. And yeah, so I'm in the recovery for that now. And I guess I'm going to try to give some information on my poem experience here. Um, and I'm also trying not to give myself huge pauses because I don't intend to edit this. I'm just throwing it up because my vision is fucked. I guess we could start there. So as an anti-nausea thing, they gave me a scopolamine patch, which just sits right there, and transdermal scopolamine. And I had it when they did the dilation last time, and I took it off right away because it's like, well, fuck, I'm leaving. Why not? And this time, I really did not want to get nauseous with the open wound in my neck, in my throat. So I left the patch on until we got home yesterday. Okay, surgery was Monday morning, and I stayed overnight at the hospital, and I was released yesterday afternoon. It is now Wednesday, my dudes. So I just left it on because I really did not want to be nauseous. And right after the surgery and in the recovery that night, my vision, I'm pretty sure, like looking back at messages I was sending people, it was fine. It wasn't blurry yet. But then overnight and the next day, it's like, I can't see. Like letters are kind of ghosting on me, and it's really weird. And so like asked the nurse, like, hey, there's something going on with my vision. So they did a blood test and like a glucose test, and still hurts. But yeah, no, that was fine. And then just looking through everything, I didn't realize that this was a scopolamine patch. And pretty sure that scopolamine is what they do when you get your eyes dilated, just in drop form. So yeah, that's why my vision's fucked. It's gradually going back, but like my pupils are still more open than they should be, which makes fine detail a bit harder. So yeah, I'm not intending to edit it because doing fine detail stuff is a little bad. And I keep fidgeting with this little guy that my husband got me. It's Mooners, little tail. Because because we have a tradition that one of us goes in for something. You know, they have a little somebody to keep them comfy during the healing process. So this is my little guy for that. Um, yeah, so for the poem, last Friday I had to start a clear liquid, no, full liquid diet for the surgery Monday. Monday to Tuesday, wasn't allowed to drink or eat anything. And they had me hooked up to an IV the entire time. And I think I probably took like 4 or 5 bags in the 30 hours I was there. But I was so fucking thirsty. They went organized thoughts. I got little cups of ice chips because I was allowed to suck on those, and those were bliss because my mouth was so dry. So dry. And my eyes. Like everything was just dried out. It was awful. Um, and yeah, so that stay overnight, and I probably until Tuesday night when I finally went to bed at like 10 p.m. I hadn't gotten more than like 2 hours sleep at a time since Sunday noon when I woke up. Like I stayed up Sunday night because there was just no way my anxiety was letting me sleep. And I was like, okay, this will make it so I can sleep at the hospital. If it was a hotel, it would be a 1-star hotel. It didn't have walls, just curtains, just fine, but not a hotel. Yeah. So then Monday after the surgery, like I got a couple-hour nap, and then husband visited, chatted with him a bit. He got home, and then like overnight, like I probably got like 2, maybe 3 more hours of sleep, which sucked, especially because my neighbor, um, big on the Fox News. So I got to hear what they're talking about for like Israel and all of that, which was great. And he wasn't playing it at night. Thankfully, I didn't have to deal with that at night, but all throughout the day, which made it impossible for me to sleep. Um, so yeah, and my release conditions were I needed to demonstrate that I could handle something. They had like the little menu thing, something from the clear liquid and full liquid. So like once I graduated from the clear liquid, if I could keep down a full liquid, then I was allowed to go home. Hi. Yeah. You want to join? And so, Izzy, it's Izzy. Um, I ordered a cherry popsicle because I thought, yeah, like I love bomb pops. I've been trying to stay hydrated with them. Like, it's not too bad right now. I love bomb pops. They're the best, but not firecrackers. Those are terrible. Anyway, uh, cherry popsicle. It was gross, but ate it. And then what did I get from the full liquid? Ice cream. Vanilla ice cream, like a little cup of it was totally fine. So I was like, can I go home now, please? Please, can we beat traffic? Because the hospital where this was like 30 minutes away in good traffic, but it could be like over an hour in bad traffic. And so it was just like, come on, I need to leave. You have 2 hours to get me out of here, and I know the paperwork can take a bit. Um, but success. Hit up KFC on the way home because I was starving. And I love their mashed potatoes. Like, it's so whatever. You can make all sorts of classist assumptions about it, but I freaking love instant mashed potatoes and terrible gravy. I love it. So that's what I had. And the husband got some overcooked chicken. So apologies there. But instant mashed potatoes. That's what I have for breakfast today, and we'll probably be having for breakfast for a bit, maybe even dinner. Because I am now on the full liquid diet for 3 days, 5 days, because of what they did. So the poem, in case you've forgotten, poem is a per-oral endoscopic myotomy. I think that's what it stands for. And so if you're unfamiliar, my problem is I was having trouble swallowing stuff. Like sometimes it could be liquids, usually it was solids. And after many tests, it seemed to be because the muscle in the esophageal gastric junction wasn't relaxing like it should have to let food through. And so the solution is to sever the muscle so it can't do that anymore. And so they did it. And well, things are swallowing easier. There's a lot of swelling in the area. Like when I've had endoscopies in the past, because I've had 4 now since the first of these tests. 4? Yeah. Uh, it hurts. Like my throat just gets absolutely wrecked, and it feels like somebody took a cheese grater, like to the back of my throat here. And that's just the normal experience for me. So there's that. But then with what they did, I guess there's a lot of swelling. And so the slow ramping up of the diet is because of the swelling and what can pass through. So it's going to be on my body when I get to move on to the next things. And I guess I'm probably going to have like a follow up with somebody in a week or 2 weeks. That appointment got made. And then in a month, we'll be revisiting with the surgeon to talk about what's next. And have to take the high dose omeprazole for the next month, twice a day. So I guess the high dose is 40 milligrams as opposed to the 20 milligrams that my husband's prescribed for just his acid reflux. So I could be taking that twice a day for a month. And yeah, so I finally got this fucking surgery done and I can move on. Oh yeah, something else that they had to do before they let me go, before they even let me eat anything, is I had to do another barium swallow, like one of the time track barium swallows, instead of just a image of where the barium fluid ends up in your throat, to make sure that the incision area didn't have any leakage, like it wasn't food or drink weren't going where they weren't supposed to. And this was done at a teaching hospital, which was, I understand people need to learn, but it sucked because like the barium fluid is disgusting, disgusting. And like there was the tech or nurse, I'm not sure exactly, who had her intern, and then there was the radiologist who had her resident intern. And so the radiologist had the resident doctor do it, and she's giving them like, okay, so this is what you need to look for. You need to position it this way, and you need to help them sometimes get into position, whatever. And that's all fine. The thing that sucked is it's like, they bring over the barium liquid in like a thing with a straw for you. It's like you get a mouthful, hold it, and then when we're ready, we'll tell you to swallow it. So the first one, it's like fine, swallowed it. But then for the second one, I guess the radiologist had some stuff to say that he wasn't fully the resident wasn't fully considering. So I had to sit there with the barium stuff in my mouth, waiting for them to stop this educational moment so I could swallow. It was so bad. And then I got to do an extra one because they want like a different angle. Because I guess the way it was looking when it was going down, that it might be splitting. And so they needed to verify that it wasn't splitting out of where it should be. So I got to do an extra angle of that, and it sucked because it's so disgusting. And trying my hardest not to barf, because I really don't want to find out what happens if that happens. Because they're right. So I'm all over the place. I'm so sorry. The poem, like they slice into the esophagus and then make a little pocket to get access to the muscle, and then sever the muscle. And so you have this open wound. And I guess the way to do this is little clips, little alligator clips, and clip it shut because those will fall off in time. Like when the esophagus, because it turns over probably. So when that skin's ready to, or is it skin? Whatever type of tissue it is, when that's ready to go, the clips will just fall off and pass. I have 4 clips, apparently, from looking at the x-ray. And yeah, so that sucked. But yeah, got the green bill of health there. So then did the cherry popsicle and then the ice cream, and then I got to get the fuck out of there. So yeah, I can finally check something off the box, move on to the other things like the weird nerve pain that shows up periodically. and get that addressed, hopefully. Um, but I just wanted to let you guys know that it happened. It finally happened. It's done. I have my cute little friend that apparently my husband bought back for May when the poem was originally supposed to be done, and he's hid it for me since. I don't know where, but he did, and it's funny, like, because I'm always here. He has to go to work, so to make sure that the package wouldn't be intercepted by me, he got delivered to like one of those locker things you can get stuff delivered to, and it's just been hiding. So yeah, I'm good. I'm good. I'm in the healing process. Um, Thankfully, I've had enough endoscopies to know that like some of the sensations are absolutely terrible, like the day of and the day after. And a lot of that was mitigated by the pain control that they had for me because the trigeminal neuralgia. And thankfully, after the first speed bump of me crying in the hospital bed, and my husband, like, hey, can she get something? Because they had me on like a little oxygen mask and that thing going behind my ear, just absolutely triggering it on top of, however tweaked my jaw was for the endoscope stuff. It was bad. It's always bad. So they were very forthcoming with the Dilaudid, so that was good. Um, and yeah, so now I just need to recover. The cheese grater sensation should fade probably within a week, and I'm going to stop talking because my voice is good. But I'm here. I will be working on the next video probably after this week. I'm taking this week off. Um, and yeah, so have a good one, guys, and thank you for checking in and support and love and all of that that you guys give me because I do have a great community on YouTube. I really do. Okay, so anyways, have a good rest of your week, and hopefully it won't be too hot where you are. I know one of you's in this area with me, and so rip. But yeah, until next time.